Welcome to the Airflow Podcast. I'm your host, Ricky Thomas, and this is the place where Kingdom heirs go to be informed and inspired. So sit back, relax, and flow with me. Welcome back to another episode of the Airflow Podcast. I'm your host, Ricky Thomas, and today my special guest is Dr. Tanya McKoy. Dr. McKoy is the owner and operator of a New You Counseling Center. Over 20 years of experience in counseling. She received her doctoral degree from the only TSU that matters, Tennessee State University. So welcome, Dr. McKoy, to the Airflow Podcast.
Oh, thank you so much. It's a pleasure to be joining you on today.
Well, I definitely appreciate it. One of the reasons why I had a desire to bring you on is my belief is that you really can't experience true prosperity when your mental health is compromised. And so I think it's very important to have a discussion, not only talk about, because I want to talk about, your journey, but I want to talk about mental health because I think there's still a lot of misconceptions out there about, why it's good to talk through some of this stuff and have somebody who is a professional do this. Outside of the church. And, I know a lot of times people talk about their pastors and certain people within the church doing that. And it's good to get that viewpoint, but, having somebody, God gives gives doctors these talents to be able to do this. So it's good to have that professional counseling. But that was one of the reasons why I really wanted to bring you on, because I think it's going to be very helpful for the listeners and hopefully it kind of tears down some of those negative stereotypes about going to get counseling and seeking professional help. So I appreciate you coming on.
Oh, yes. Great. I'm excited that you're doing this because this is how we get the information out there. We got to continue to open up dialogue and continue in conversations because otherwise we will continue with all the myths that we have about getting help.
Yes, ma'am.
Counseling.
Yes, ma'am. Okay. So I mentioned, you've been doing this, over 20 years of experience in counseling. You're also an ordained minister. And one of the questions I wanted to ask you is, do you see is there sort of a line that you draw between your ministry and your being ordained as a minister and kind of your following there versus being a counselor? Do you see there's a correlation or is there sometimes a conflict between the two?
Oh, no, actually, they kind of work hand in hand if we think about it. Because a lot of times people that are in a ministerial role, they're doing some type of counseling, right? Counseling means to get help or to assist. And so I think the skills build on each other. There are times when people come to me and because I understand faith. Now, sometimes we share the same faith and sometimes we do not. And that's okay because I can kind of understand what is it that they're talking about. Right. And now there's a lot of people who really want to have their faith incorporated in counseling. So I think that gives me, additional insight, being able to, be licensed as a minister, but also, well, as an associate minister, let me clarify that, but then also be able to use my clinical skills as well.
Okay. So a little bit about you. Obviously, you're a mother of three. Is it three, right?
Yes.
Okay. Mother of three, grandmother as well.
I know. Whew.
Don't even
that surprises me every day.
So you are great. Do you prefer grandma? Do you have like a little term that you want to be called?
Yes, it's Gigi.
Gigi. No. Okay, you're Gigi. I love that. I know a lot of mothers who become grandmothers are like, I'm too young and fabulous to be called grandma. I want to be called granny. So Gigi is always the one. So going from motherhood, obviously doing this for a while, what was that desire for you to sort of get into this profession? What sparked that for you?
It's so interesting. And it's actually one of the questions that I love answering because it's so different. My background is engineering. Okay. I was in engineering and I had a best friend and I was working with her. I was working with a mutual friend of ours about an issue that had came up. And my friend had stated to me, hey, you're pretty good at this. You ever thought about counseling? And I was like, what's that? And so she knew more about it than I did. And I remember contacting the boards to see, because they said if you could use your personal experience and if you could pass the test, you could be kind of grandfathered in. When that test came, I was like, oh my goodness, I don't even know what this is. It was like maybe a test or a test template.
Mhm.
So I had to go back to school, but that's how I got into counseling. Had no idea what the career was about. Hadn't researched it. I had always wanted to be an educator until
Mm.
I got into engineering because I love math.
Okay.
I love solving problems. I mean, I would stay up to the wee hours of the night. So I was a STEM baby, I call it. I love to solve problems. Math was my thing, and did not know what counseling was until my friend had mentioned that.
And that's good because there's a correlation, obviously, with math. Like you said, you're solving a lot of problems, but in counseling, you're helping people solve the problems or unlock different mysteries and things. So in their lives, so it kind of goes hand in hand. And most people won't think about it like that because engineering is so black and white. It's so factual. It's so thinking logically and matter of fact. And so it's good. It's kind of refreshing to hear that and kind of think from that way. So you go from being this person that was big with math and numbers and solving problems to helping people unravel the problems in their lives and kind of get through that and push their lives forward. So that's pretty good. That's a good changeover.
It is. That's exactly is how I explain it to people because they sometimes don't see the correlation, but you grasped it right away. So that's impressive. And the part that's very interesting is that when I first got started, I was trying to solve it all in one session. Of course, I had
Mm,
to just had to kind of calm down and just
right.
let it, simmer or whatever now. But yeah, definitely the same kind of skills that I used in engineering transferable into the counseling.
It's interesting you said that about trying to solve it all in one session because my background has started with engineering and went to computer science, so I understand trying to pull everything together and like want to get it done and not have anything linger. So how do you get to when you're with a client, how do you get to a place where you feel like, okay, we can stop right here because you're starting to unravel things and things are starting to go and he's like, oh, we got to stop. Like how do you do that?
Yeah, that's really kind of interesting because right now my sessions are 45 minutes. And
Mm,
so I have to pay attention to the clock. And a lot of times people they they may not feel led to share something to like the end of session, like the last 10 minutes, and then it's like this big item. And it's like,
right.
oh my goodness, we can't unravel that. But it
Yeah.
all depends on, where they are. Um, because a lot of times people are coming, that's the first time they've actually been heard. So I try not to say, oh, we'll talk about that next week. So
Mm,
sometimes I have gone over the time frame. I try not to do that often because then I have someone else that's right next, coming up. But I think the way I balance that is really dependent on, first looking at the urgency of it. Is it something that I really need to talk about? Or is that something I'll say, you know what, this is really important and I think it is. And I may add, let me make a note of this. And when we come back next week, let's talk about it. And then it's going to bring up some thoughts for you.
mm,
So maybe you can make note of it as well. And then we
okay.
come back and see. And so that's kind of how I do that. But it all depends. But that's one of the ways that I kind of, manage that moment or manage that time.
Okay. And you mentioned, sometimes it takes people a while to get to get comfortable with mentioning things. And, I want to touch upon that a little bit because it seems like it's always difficult to even get people to come into these sessions. Why do you think it's so difficult for people to find get to a place where they feel okay with at least coming to get counseling?
Oh man, that's the magical question right there, right? There's so many facets to that. One is that people just not sure what to expect. It's not something that's been common. And well, it's more common now because of the pandemic.
Mm,
But a lot of times people didn't know. They thought, from TV, they were going to lay on a couch and somebody was going to go just take them back to their childhood and say how bad their parents was. And this
right.
is the reason why. And it's really not like that. So we have this misconception about what therapy looks like. And then the other part is that it's really not talked about. A lot of times you think in faith-based communities, you don't tell everybody your business. What's
Mm,
in the house stays in the house. And so
right.
people are dealing with that. And I think the other part of it is that people look for therapists who can relate to them. And so we haven't had a lot of people of color in the field. I mean, we're seeing more of that now, but from a statistical purpose, there's really not a lot. And so and that plays a part. So they want to make sure that when they go in and they talk about situations, that the person that they're talking to can understand them.
Right.
Now, even though we tell our clients we may not experience exactly the same thing that you've gone through, but we've experienced something enough that something similar that we can draw from. We may have felt the same way, we may have thought the same things. It may not have been about a particular similar event, but we're trained to pull that together in order that we can hear them and kind of relate. And then also that helps us know what questions to ask and what things to look for.
Yeah, and I guess just with you saying that, I never thought or put much thought into the idea that, based off of faith-based community and even the African American community, it was always kind of taboo to tell people your problems, that's outside of the family or outside of the house. So, it's almost like that may lend to why you don't see as many people of color inside of this career path. I mean, I know it's growing a little bit more and more, but that could be why, just because it's traditionally kind of ingrained in us, like, hey, you keep your problems inside the family or to yourself, or take it to the Lord, and he will solve all those problems, and he can and he will. But sometimes he puts people in your path, or he guides you to go get counseling from the right person that can help unlock those things. So
Oh yeah.
that's good. That's good that you look at it from the state of being able to relate with experience, but not necessarily experience the same things, but relate to them. So you could pull it together, because I think that's important, to be able to help people kind of piece together their thoughts and figure out kind of, this is where the root of the problem is. And I think that's where a lot of people don't understand the good part about it. Sometimes it doesn't have to be a big serious issue. It can just be you having problems gathering your thoughts and having problems concentrating. You can't figure out where that is. It doesn't have to be something that's just so terrible in your life. But from what I've learned and read about, a lot of counselors, they don't just have to deal with grief and just bad things. It can just be, I just need help. I'm not thinking clearly. I don't know what it is. And you may uncover some things that you just never thought about. And that's where a good counselor can help get you through that. So
Most indeed, because I think that's another reason why people don't come, because they don't understand what you can accomplish in therapy. Most time when people say a therapist or go to a counselor, they think about, they've got these diagnoses like, personality disorders or
right.
bipolar, and they're like, I don't have that. But like, just like you're saying, mental health covers everything, anything that deals with your overall thinking, or your emotions, or even your actions or behaviors, if they're somewhat impaired. So right, if you've got goals and you're having a difficult time achieving your goals, yeah, definitely go to therapist and can do exactly what you stated, help you unlock maybe what are the barriers, what are the stuck points, to help you move forward. And a lot of people don't think about that. Relationship with your family, that's also a reason that you can see therapy. So it's not just what we think about, quote unquote, the serious mental health issues.
Mm-hmm.
They're just life issues. I think
Right.
they've stated, if you're having difficulty adjusting with life at work or whatever it is, then those issues can be helped.
And I think you mentioned just trying to understand why you can't reach certain goals in life, or you've written out these goals and you kind of got this plan and you're just having struggles getting to that place. I don't think a lot of people think about going to a counselor and seeking therapy for that. I'm thinking about it now, and I never really looked at it from that perspective, looking at, okay, I've got these goals in life, and I'm having trouble with this goal. I'm going to go to a therapist and try to figure out why. It's always, whatever the situation is, you never look at therapy. You look at other avenues to try to figure out where that is. So that's actually interesting. So, knowing that goal setting is a big part of being a kingdom heir. You have goals, you have, things that you want to accomplish and that you're supposed to accomplish. For those people who are having trouble reaching the goals, understand that therapy is a good way to help bring that stuff together, figure out where you're getting stuck, and then figure out ways to get around that, and having somebody who can help you do that. So, it's almost like you're a coach as well.
Exactly. I mean, your coach, and also thinking about your friends. A lot of times we talk to our friends about the things that we're having difficulties with or challenges with, and they listen, they provide advice. It's just that their advice may be somewhat biased,
Mhm.
or you may not share it in its the information, you know, um, entirely, because you may be concerned about them casting judgment on you. So you don't
Right.
want them to think different of you. But so we're used to getting help or coaching from other people and how to do it, but just working with a therapist or a counselor is that that person has you have their undivided attention, and there's a space for you to meet with them, mostly starting off as weekly. Some people do different variations of that, but that is your time for you to focus on all that you want to focus on at that time. You don't have to worry about them distracting, being distracted by other things. But the most important thing is that it is confidential.
Right.
So we're bound by HIPAA to that the information that you share, unless there are things that we do have to report, because we are mandated reporters for items, abuse and neglect and things of that nature.
Right.
But other than that, we're bound by HIPAA to maintain that information. And so,
Yeah. I think confidentiality is definitely a big factor to why people may think like, well, I may see this person out on the street somewhere and they may be looking at me crazy, like, oh, that's the person that told me all of this. So, I can see where some people who have never gone and they're already skeptical about talking to anyone about their whatever the situation is. They can feel a little bit about some kind of way about that. But I definitely read that there are laws and things that prevent counselors from sharing information, even with minors. There are certain things that can't be shared with parents, and so unless it's detrimental to the physical well-being of that child or that person. So like you said, there are certain things that you have to report, which is good, because it helps to make sure that balance is there, so you're not dealing with people who are potentially suicidal and things like that. So it's good to know that you protect their interest all around, whether they
yes,
want you to or not, but you're protecting them across the board.
that's right.
Okay. One of the things, and I hear these terms kind of thrown around, and sometimes they're thrown around together, but I think there is some separation between them. Can you explain what's the difference between a counselor, a psychologist, and a psychiatrist?
Oh, yeah. Those get confused often. I'll start with the counselor and the psychologist.
Okay.
I typically, these terms, when they're usually mandated by the state. And what I mean by that is that they require a license. So no one can really call themselves a counselor unless they're licensed,
Okay.
especially in the state of Tennessee where I'm at. So, and a counselor typically is someone that has, for the way it stands today, has a master's level license to practice independently in the state. And what
Okay.
that means is that they don't have to have supervision. And so these persons that most have had a master's degree in it, they've gone through some training, some practicum experiences, had some testing, and they passed the boards and they're not licensed. A psychologist is a PhD level. So they've
Okay.
undergone additional training. So they are usually more experienced to deal with a very more variety of issues, as well as testing. So if you need testing or assessments done, typically that's going to be done through a psychologist, because that type of work is protected by that field.
Okay.
So, and they go through a more of intensive internship training, almost like a residency program, similar to what medical doctors go through.
Mhm.
And so, and that's another term that's protected by the state. So you can't just call yourself a psychologist unless you are licensed by the state to call yourself that. So that is a protective term as well. The psychiatrist is along the medical field. So those are the persons who actually have a medical degree. They just specialize in behavioral medicine or
Gotcha.
psychotropic medication.
Okay.
So those persons, while their specialty is medicine, is mostly medicine dealing with mental health issues. Now, some of them may do a little therapy, a little counseling, but if it's something long term, they're gonna refer you to the psychologist or a counselor to address the mental health issues. They're gonna utilize the medicine in order to kind of provide some stabilization. And a lot of times people don't like the word, oh gosh, I gotta get meds from a psychiatrist. But I tell them to look at it just like you would from a medical doctor. Sometimes you need medication to kind of help stabilize you until you're able to make the behavior changes that you need. We think about diabetes, right? The medicine
Mhm.
for that insulin. Some people use that, but until they change their behaviors, their lifestyle, exercise, and things like that, they can eventually come off the medication. Same thing with psychotropic medications. But then there's some medications that you may have to take for a long time. And think about in the medical, that might be someone who has maybe heart issues or lung issues, or let's say they may have had a lung transplant, so they have to maintain a certain medication. Well, there's
Right.
some people like in mental health that have to take those psychotropic medications, for a longer period of time and maybe even for life. And so that's one way I try to explain it to people so that they can understand the difference.
Okay. And that makes total sense. So you're licensed as a counselor and a psychologist, correct?
Yes, license as both. Yes.
So do you work, let's say you have, patients that you're dealing with, and do you refer them to psychiatrists in certain points if you feel like they need that, or do they have to go through a different route to potentially get to a psychiatrist?
Yes, definitely, I do. And we this is kind of a collaborative approach now between the primary care physician, the psychologist or counselor, and the psychiatrist. Because a lot of times you need that trifold, provider services in order to become the best person or to help you address that issue. And so definitely I would refer them to psychiatrists. I also encourage them to contact their insurance companies as well, because I don't know every psychiatrist and I don't
Right,
know
right.
all the different areas. And I try to at least give them three names or three organizations that they can get the medication address. But yeah, there's certain things that I'll look at when I'm working with people. There's some smaller assessments that I'll do that'll help me guide based on what those assessments show, as well as what the individuals may state. I may refer to medication. And a lot of times there are people who are doing both. And sometimes they're being prescribed medication as well as working with me for the behavior part of that.
Mhm.
And so all the we think about it, it's just we have to address a lot of times the physical health, the mental health, and the emotional health all together so that people can work through whatever it is that they need to work through.
Yeah, that's good because I think some people they think they forget about the part that sometimes medication is needed, and like you said, it doesn't have to be forever, but as the person is working through whatever challenges that they have, the medication is there to kind of help with the whole, like you said, it's kind of a holistic approach across the board to say we're taking care of it from the primary physician, the psychologist, and the psychiatrist to make sure that we're getting everything dealt with in the right way. So that's good that there is collaboration there, and so this is good for for people to understand that sometimes it's not just about the counseling sessions and and going to a psychologist. You may have to look at other avenues, but when you have a good team of people around you, they can help to foster those decisions in the right way, so you're getting the right treatment. Because like you said, you can go to counseling sessions so many times and it may not have much of an impact because there's something that is of a medical state that's preventing or blocking that person from being able to receive what they need to receive from the counseling session. So and I'm sure you've seen that happen several times, over your careers, is kind of that extra step to kind of help that person get through and break through what they're dealing with, whether it's depression and things like that. You can talk about it, but there's still something that's missing to help really that counseling session kind of go over the top. And sometimes it's a little bit of medication to get to that point. So
Oh, most definitely. And the other part of it as well is that a lot of times I do refer people if they haven't had a complete physical within a year. I refer them to their primary care because there are some medical conditions that can look like depression or mental health issues. So we
mm,
want to make sure that we're treating the right thing. So definitely, it's And I think that's really good that we have that sense of care,
Yeah.
that the providers are working together such that it is, you see more of an interdisciplinary type of treatment approach now, where everyone realized that if we're looking at it from all perspectives, it's just going to be overall better for the person.
Yeah, and you mentioned, it's funny you mentioned a little bit about that because I was going to ask you this a little bit later on, but I'll ask you now. Yeah, I was reading something, just doing some research, and I saw that there were people that were basically saying that if you address mental health properly and do what you're supposed to do in addressing your mental health, it can actually improve your physical health and save you money from a lot of the physical conditions that take place in your body. Do you believe that?
Oh, most definitely. Because if you think about stress, if we just look at stress, a lot of times people, unmanaged stress can result in a lot of physical issues. People can have, heart issues, heart attacks, strokes. It can also result in upper GI issues as well.
Mhm.
It can manifest in uh, skin conditions. I know some people have had that as well. And so, yes, definitely not addressing mental health issues can also lead into physical health issues. That's why you see a lot of primary care physicians now, they will ask you about depression and stress,
Yes.
relationships, and things as well, because those things do impact and can impact severely.
Yeah, I know, just taking, we take our kids to their physicals each year. And I know the doctor, they ask a lot of questions about, then they ask about depression. Are you having good relationships with peers and things like that? I mean, they ask a lot of those questions. And for a while, I used to wonder, like, why is he asking that? They're just here for a physical. But understanding now that from my perspective, and sounds like you agree with that, attacking your any mental health issues can help prevent a lot of those, or come to find out what the root of the physical issues are. So and I know that because I've done, the podcast previously I've done about fear and just how fear can impact your life and bring about stress and just how it works through your physical body. It was just interesting learning about that and just understanding that mental health is just as important and can prevent a lot of the things, like even some cancers forming, because of just overly stressing yourself out and your body just not being able to work the way it was designed to work because your brain is just functioning, totally off base. So that's definitely good. That's good to hear. And again, these are good nuggets because I think a lot of people don't, sometimes they don't equate that with why they're having that, even eating disorders, or gaining weight. Some people are emotional eaters, or they do things like that. Instead of attacking the problem, they're like, okay, well, I got to lose weight, and they go on these big diets and these big regiments. But the main thing that they needed to do was attack the mental issue that they have, and get to the root of that, figure that out, and then they would get out of the habits that they had from eating. So people, and a lot of people don't look at that. And I watched the show probably about a year ago, and that was one of the biggest things, is that they said before we start any kind of plan for your health in terms of working out and things like that, we have to get you to a psychologist. We have to figure out what started you down this path to get to gaining weight, because it doesn't, you just don't start eating yourself into a place like that.
Exactly. And if you don't understand, the root cause, what happens is that you're more than likely going to repeat the same behaviors again. So
Right.
whatever change you make is only temporal. And it's not sustainable, because you'll go back if you don't understand, yeah, your thoughts, your emotions that led to you getting to that place in the first place, where food had become a comfort for you more so than dealing with issues. And that's the part that people think, when they're dealing with a lot of life issues, they think they're handling it because they're ignoring it, but that's not healthy either. And so, you, by ignoring it, you're not addressing it, and sometimes it lies dormant, but it builds up over time. And then we see people with anger issues, and they stay in this perpetual state of being this highly aroused person, especially when they're dealing with anger.
Mm,
And our bodies were not designed to take that stress for that long period of time.
right.
It was designed, for a short moment, for if you have to defend yourself, but
Right. A
not to
fight or
be in that
flight.
state. Exactly.
Yeah. Yeah, and I think again that's why I know we hear people, I've heard the term being thrown out more and more now so than ever, just from people who are not in the military, but they've just dealt with, violence in the street or just around violent areas. And they talk about people suffering from PTSD, just because they're basically it's the same kind of conditions, they're always having to be in survival mode.
Yes,
And having to do that, like you said, we're not designed to be in that mode for a long time. So when you're always in that mode, it totally changes who you are as a person. And you're always wired up, you're always easily triggered. And again, you got to have a way to decompress. And that's where, having counseling sessions, talking to a counselor, a psychologist, and possibly even going through to a psychiatrist and getting something to help, take off the edge a little bit from that, because a lot of people are self-medicating in the wrong way.
indeed.
And of course, that's never good. So you talk about drugs, alcohol, you talk about eating, there's sexual thing. I mean, there's all kind of things to try to curb the pain, but you never get to that place. And that's where, somebody who's licensed in this field can really help with that.
Yes, sir.
Okay. One of the things I know, and I've always wondered this, you being a psychologist and doing this for a while, is how do you really separate, personal life, especially if you've had some of the same experiences as experiences as some of your clients? How do you separate personal and your professional life, doing this, and you're doing this for as long as you have? Because that seems to be, to me, that seems like it's difficult if I have something going on at home. And it's one thing if you're an engineer and you've got something going on at home and you got to, I got to focus on this task at work to get this project done. And, it's not really related, but, but if for you as a, if you got something personally going on, it's like, okay, I got to deal with this, at home, but then I got to go in here and hear somebody else tell me about something that's pretty much the same. Like, how do you separate those two?
Oh, yeah. Excellent question, because, that does happen, and it's happened to me. And one of the things is I have a strong support network, right? So I have people that I can confide in about things. But when one of my clients' issues is triggering me,
Mm,
I have a therapist as well. So therapists do have therapists, and that was one of the things we were trained in the program that my master's program, is that we need to make sure that whatever happens or going on with us, that we can make sure that when we're working with our clients, we're doing so with a very objective eye. And there are going to be times when their issues are going to trigger us. And we
mm,
have to make sure that we're not responding to them out of our pain. And
right.
so in order to do that, we have therapists as well. And so, and I had that occur with me before. And definitely I worked with a therapist to work through my issue, what my stuff, so that my stuff would not come into the session, and that I could be very attentive to my client. And that's one way of doing that. The other way of doing that is that, I have clear boundaries about, things that I talk about in session, things I don't talk about with session. But then I also know me well enough. I've gone through processes of introspection and reflection, such that I know when I'm not the best me. And when I'm
Mm,
not the best me, I have to make sure I go and do the things that help me to be my best self.
right. And that's good because you're not putting yourself in harm's way. You're not, and also hurting the client because, if you're not at your best, you can cause that client to spiral out of control even more if, you're getting triggered, and then you're cloudy and with your thought process, and then they can't get through their process. So that's good. I mean, and for me, like I said, outside looking in, that just seems to be very challenging to deal with on a day-to-day basis, especially when you've got, you may have 4 or 5 clients lined up back to back to back, and you got this thing going on over here. Do you ever just have to reschedule at times to say, you know what, I'm being triggered right now, I need to shift some things so I can get myself back in line, and then come back in and reschedule it so everybody's on a good path? Do you ever do that?
I've rescheduled, but if I meet with them, I'm not going to reschedule in the moment, right?
Right, right, right.
Yeah. So if it's the day and I feel like, oh my goodness, yeah, this a bit much. If something happens, if it's an anniversary date, because you kind of know about many may know, some don't know, the death of my son. And so his birthday and things of that nature, I know those are dates for me that I'm sensitive, so I don't schedule anybody those dates. But in session, right? I've been in sessions, and I had no idea that some of my clients were dealing with the death of a child. And there was a person who had almost a similar story as how my son died, about the same age, a lot of things. It's like, oh
Wow.
my goodness. And so I'm feeling myself, something going on the inside of me, but I'm like, I gotta stay focused. I'm talking to myself, you gotta stay focused. You can handle yours after this session. So if you
Right.
keep it together until after this session, and then I can have my release, call a friend, cry, whatever I need to do. And so those are the things I have to communicate to myself. But sometimes, and I can feel it, and I have to let them know. I may say something like, you know what, your story is greatly impacting me. That is the truth. Now, they don't know why it's
Right.
impacting me, but it's impacting me in multiple ways. I'm just not going to go into why it's impacting me, because then it becomes my story instead of
Right.
their story. So I may acknowledge that, your story is impacting me in many ways. And I'm
Right.
just going to sit here for a moment with it and let you know that. And so I have to, yeah, I'm going through that. I'm doing some mental, gymnastics a little bit, trying to make sure I'm staying present for them,
Yeah.
but yet trying to hold myself together. Absolutely.
And so this is the human side of what you do, and you have those moments, and it takes a certain level of strength, because as you mentioned, your son was murdered a few years back, and here you are, talking to people, because you also do grief counseling. So you're doing grief counseling and going through that, and you're still grieving in different ways and working through the process yourself. And as I mentioned to you before, that is a level of strength that I don't think many people know and really understand what it takes. And it may not be the death of a child for somebody. It could be something else that was just majorly tragic. And as a counselor, you have some of those experiences, but it's good that you said you don't project your experience onto that person in that session, because it does start to take the really the direction away from them and where they are, and
Yes.
getting them help, and it becomes kind of you guys going back and forth talking about, yeah, I did this, and yeah, we had this, and now they're not getting the help that they need to get. So I definitely commend you for that, because that has got to be challenging to deal with that, on a day-to-day basis. And sometimes having those reminders, like I know you said you get triggered around, certain anniversaries of the experience, whether it's the birthday or when he passed. But at the same time, knowing yourself enough to know that I need to shift some things, or it may not be a good day this date, I may not have anything going, it may just be my day to process things.
Yes.
So that's good, because again, it's not about, some people just like, I got to make that money, I got to get out there and get these sessions in and get it done. And you're like, no, I know how to adjust my schedule so that I can be fair to my clients, but also I have to be fair to myself. And that's the way you can be strong in the process. So I definitely commend you for that. That is great that you can do that and continue to work through it, and saying that you have the support, you have a therapist yourself. And some people would think, well, that's crazy, how somebody who's a therapist have a therapist. It's like, how does a barber, somebody cuts their own hair, can cut hair, why do they need somebody to cut hair? But well, I always equate that to a barber. There's certain blind spots that barbers can't
Yes.
see on their own head. So when you look at somebody that's a counselor or a therapist, there are certain things that they just can't see for themselves, and they need somebody else, just that outside person who may have some understanding, and you feel comfortable and confident with, but they can dig in there and find those little pieces and help to shape it up the right way in the back or the blind spot, and they can help
Yes.
you get around that. So that's good that you can have that. And that, it sounds like you said that's something that they when you go through and you train it, they tell you should always have your own therapist to deal with what you're dealing, because you take on a lot of weight as a
You
counselor.
do. You take on a lot. And I think not only did they suggest it, we actually had to implement it into it.
Okay.
So part of that was like, do you guys have a therapist, as you
Right.
go through this program? And so, but yeah, indeed, and you don't realize it until you actually get in it. But the other part of it is that throughout each day, I'm listening to a lot of people and what they're going through, and through that day, I'm It's what I do, it's what I'm passionate about. And so I have the energy to do it.
Mm,
But you don't realize, if you don't have a release, and being able to separate all of that, then you're carrying the weight of not just your stuff, but your client's stuff as well.
yeah.
And that's not helpful. That's not helpful to them or to yourself. And so those things, having a therapist, doing self-care, all those things go into me being the most effective so that I can be the most effective, for my clients.
Right. And it's the same, like I'm sure you preach that to your clients to make sure that they are doing self-care, they are taking the time off. So it's like you've got to prescribe your own, you got to prescribe yourself the same
Yes.
medicine to make sure that you're doing the same things. But a lot of people, again, they don't think, they're like, why would I need a therapist? Why would she pay money and go through that if she's a therapist herself? Well, it's hard to, sometimes it's hard to evaluate yourself and where you are,
Oh,
just
yes.
because, especially like you said, all the weight that you carry during that session, you're hearing things that are completely confidential, and people are, pouring their hearts out and telling you things that they can't tell, their spouse or the closest person in their life, and things that they've held secrets for, years and years and years. And you've got to not only carry that, but you can't push that off somewhere else. You can't let anybody else know that. That has to stay with you. So, you got to be able to decompress and walk through, some of those things. So, having a therapist of your own, that definitely makes sense, because I know that just that work-life balance for this career just seems like it is very, very challenging. It's doable if you have the right tools in place, but I see the challenge with that.
Indeed. You have to be intentional. And I'm always thinking about, if I'm encouraging other people to do something and I'm not doing it myself, then why am I in this field?
Right.
And so I do not ask of my clients anything that I would not do myself or have not done myself.
Okay. That's good. That's real good. You mentioned the pandemic earlier. Since the pandemic has been around, have you seen, I guess, a common thread amongst some of your clients in terms of just the emotion that they're feeling from just how this whole thing is uncovered and, continue, being locked down and all that? Are you seeing some commonalities across some of your clients, and just in general in the field of, psychology? Are you seeing some common threads there?
I think one of the things, and actually my clients have talked about it, is that the pandemic exposed or accelerated issues that were already there.
Mm,
Like, they were already having issues with family members or with spouses or with themselves, but the pandemic just really pulled the band-aid off,
mm,
basically. And so it created this sense of urgency to get in and get some help.
right.
And I'm seeing a lot of that right now. Things that they've dealt with, and they were managed because work was a distraction. A
Right.
lot of times when we're dealing with heavy things, work can be a distraction. And so not being able to go in and see other coworkers or just driving to and from work was a way of escape for these persons. Now it's not. So the issue you're dealing with is right there in front of you,
Yeah.
now 24/7. So I think that's what has been the common thread from all my clients thus far.
Yeah, that makes sense. I mean, my wife and I had this conversation. We talked about our marriage, and this, when we said, if your marriage can survive through the pandemic of having to sit there and be amongst each other, and you had to talk, if you find out the strength of your marriage and your family, especially last year when we were on lockdown, within your house, you really start to see, how strong your family bonds are. Not saying there's not challenges, but you start to see, like, are you really tired of being around that person? Are you tired of, you finding out certain things about my kids, and we found out different things about our kids. So it was actually good for us. We didn't have, and it helped. It was therapeutic in a way, because we were forced to sit down and sort of, address things head on, because there was no escape around it. So it was definitely good. But I also see some of the other parts when you're used to being social. Like, some of my kids are like to be social, and being locked down, and having to go to school virtually, that was tough, and it was tough even for my wife and I to a degree. It was tough because, used to going into the office and having face to face. I mean, we always had a desire that we wanted to work from home, but it
Mhm.
was on our terms. We
Right.
wanted it to be on our terms. And it's like, now we're forced to work from home. And then you can't not only work from home, but you can't go to the store just normally like you wanted to. You can't go to a mall. You can't just take a break and get away and go other places because it was a lockdown. So that was definitely a challenging point. But again, it taught us a lot about ourselves and really how to get through things. But I can see, I definitely know therapy is definitely something that's good. And you do group therapy sessions too, is right?
Um, I used to. I don't do as much now,
Okay.
but I have done groups, and yeah, there's something about the groups, and it's so powerful. Just the when you've got this, I think the synergy of having other people in a room together working on
Hmm.
things, and for me as a clinician to see that when there may be one person who's struggling with something in the group, and then watching as the other people, they've created this relationship now, and they're working together
Right.
and they're able to help one another. It's such a beautiful thing to watch.
Yeah, and I've seen that in not necessarily group sessions, but just in conversations or town halls with, you get somebody up there talking, maybe a higher level executive, and they're having conversations and they open up the floor to say, hey, are there any questions or concerns? And everybody's looking around at each other. And then you get one or two people start to talk and open up and share. And you get some more people starting to open up, and then that synergy, and everybody's like, really, now they feel like it's a safe space to talk about whatever they needed to talk about. So I know group sessions is some people, and when people say group sessions, and it does it necessarily mean is it same people, is different people with the same type of problem, or is it just like, how does the group session work? Does it have to be they related, or do you bring in like, I guess, just could you explain how a group session would work normally?
Oh yeah. So it all depends on, the person who's leading the group, how they structure the group.
Hmm.
Because sometimes it could be based on topic. Let's say you're doing a stress management group. So everyone in there, right, is more of a heterogeneous type
Hmm.
mix. So people come from different backgrounds, could be men, it could be women,
Right.
as well. Or the group could be set up that they meet for 6 weeks, or it could be a group that meets ongoing. So people can come in and out of it at different points. So it could be that way, or it could be a group where it's specific, where this group is for, female, age 13 to 14 years old that
Hmm.
have one sibling that attend this school or these schools in this community. So it all depends on the focus and kind of how the facilitator uh, designs the group.
Okay. Yeah, and I guess you start thinking about like anonymous and things like that. That you have people lead, and I guess it's kind of a topical based thing where everybody's there for a program. And you have usually somebody who's a counselor or something that leads it most times. So I guess it's in a similar fashion. Would that
Yeah,
be correct? Okay.
that is correct. And then sometimes they have substance abuse treatment programs where it doesn't matter, what type of substance that you use, just as long as it's a substance. But then there's certain programs that they are specific to the type of substance. That is absolutely correct.
Okay. So doing what you do, you said there's a certain amount of excitement. How does it make you feel when you know that you've unlocked something for one of your clients? Like you have that light bulb going off, that aha moment. Like, how does that make you feel when that
I'm
happens?
ecstatic. Oh, I'm so ecstatic because not sometimes I may see the situation or the pattern before they do. I
Hmm.
see the barriers or the block or the stuck points before they do. But when they get it, oh my goodness, I'm ecstatic. It's almost like a proud parent. Not saying that we have this parent-child dynamic in
Right.
session, but it's just that how you feel to know that someone else that you've been working with or guiding or even a coach feels when someone achieves their goal, that they got it and they figured it out, but you were there to help guide. I see my role as a guide along this process because a lot
Okay.
of times we have the skills or we have the capability, I should say it that way, and the capacity to really solve our own problems.
Hmm.
Sometimes it's hard because one, we've not been trained to do so, or two, we need to think outside of the box. And so having a person who's not involved in your everyday life, who has more of an objective eyes on the situation, kind of helps promote that growth.
Yeah.
And so I feel, yeah, I'm so encouraged, excited for them. I share my excitement. I provide praise to them because it's a huge accomplishment when you get to a place where you can identify what has hindered you as far as your thinking or your feeling or even an event in your life, and you can tie it all together. Oh my goodness. That's such a wonderful thing to witness.
Yeah. And you said something that I think is very good, because you said that, through the process, sometimes you see the thing that's bothering them or that's challenging them ahead of time, but you don't try to expedite it, and call it out and say, this is what it is, and get them moved on. Because I think there's some, there's some strength to letting them find out and discover where that issue is. And then once they discover it, now they'll be like, okay, they're more receptive, even though you've seen it. And you're like, okay, I know this is where it's going, but you're still allowing them to get it out and not, not shorting them out of their chance to vent and then get it out. And then once they get it all out, it's like, okay, now I see it. And you're like, yes, but they don't know that, they don't know that you're kind of there, and you're not pulling them through the process. You're just, like you said, coaching them on and just walking them through it. So
Yeah.
I think that's a good thing, because it would be easy to just say, oh, I know what this problem is and I can solve it right now and tell you this, and this. But the person may still be, left feeling kind of empty because they didn't get a chance to really talk through it. You go straight from, I'm giving you a problem statement, here's the solution, but there's no in between, of how I got there. So that way, if something comes up like that again, I'll know how to walk through that process, and that comes from kind of that engineering thing. You can't just, put an answer on a paper. When you take a test, you can't just write the answer down without showing your work. You've got to
That's
have the work there. So,
right.
okay, well, that's good. So, what advice would you give someone who, is interested in looking into this field of work, and maybe they're already in a career, maybe in a similar situation to you, or they're getting ready to make a decision about what they want to do and study in school? Like, what advice would you give somebody in terms of starting off in this path?
Oh, yes, I think this is a wonderful field to start off in. I would tell the person, don't just stop, even though you can stop at a master's level, but if you have the desire, go ahead on to a PhD level. Of course, it takes more time, more investment of your time, but I think we do need more clinicians at that level. One of the things is that a lot of people worry about cost of education. There are grants out there,
Mm,
there are programs out there to help fund, especially those in counseling or psychology fields, because a lot of times what people don't realize that it is considered a soft science. So a lot of the STEM monies, the money towards the science, technology, engineering, and mathematics, some of those programs also allow for um, counseling or psychology. And if
really?
you're a person of color or a person in a minority status, there are a lot of funding out there to help, because we know that there is a inequity regarding persons of color in the field. I think there's a program that was awarded to several HBCUs, even for the perspective of primary care physicians, especially during this pandemic, because
Mm,
people wanted to go to persons that they trust and
right.
that look like them. And so there's funding out there now to try to get more people of color into these different fields, medical fields, which includes psychology as well. So one of the things you can do, you can Google or look up programs or schools that have psychology or counseling programs.
Okay.
A lot of the programs offer, especially PhD, many of them offer where you can do a grad assistantship as well as master's program where you teach and they pay your tuition plus, give you a stipend. So
Okay.
don't let finances be a factor, um, because it's needed. And now there's so many programs out there. You can be very specific if you want to be an overall general practitioner, but there's some people that specialize in Christian counseling, or if they
Mm,
want to focus on, addiction counseling, or do more of assessments. So there's so many different fields out there. Neuropsychology or neuropsychologists, you want to work with people that have had brain injuries. And
mm,
so there's so many options out there, and um, just ask
okay.
and you know,
Yeah, and I think, the financial part, everybody, when they hear about people wanting to become or going to, medical field and anything in where you need to become a doctor, cost is always the first thing that comes up. It's the time to study for it and then the cost. Cost is usually the biggest one. And I think just the information that you shared, that there are grants out there available, and taking advantage, because there's a lot of money that's usually out there for programs like that. And like I said, especially in these times where we really need, going through pandemic, you're going through all the, different social economic issues, racial issues, just, things that are happening in the political field and just causing just overall impact to people's everyday lives. There is a strong need for, counselors out there. So that's definitely good information. And hopefully people will take advantage of that, and that are interested in going into that field. One question I have for you, and this is more lines of, getting somebody who is resistant, but that they need counseling. Let's just say it's a situation where you have a friend or family member, and that everybody's trying to say, hey, they've been dealing with things for decades. They just can't let go. And it's been weighing them down, and it's starting to weigh on the people around them. But that you suggest counseling, but they just like, I really don't need it. I'm good. They always have that I'm good. I've been dealing with it for this long. I don't need any help. How do you help a person or help a group of people get that person, at least to try out counseling to get, because I know it's going to take them to want to do it. You can't really force it, but what are some tools or tips that, you can possibly give people to help? Because I think a lot of people they have that stigma of not wanting to go, because again, it's that I don't want to tell other people my problems, and, make light
Yeah.
of, or put things out in the light that, about the family potentially, or things like that. But, how do you, what are some things that you can say that can possibly, some ideas of things to try? Nothing's guaranteed, but at least, some things that other people may consider that, they may not have thought of before.
Yes, and that's happened. I know a couple of things that come to mind is that, especially if there are minor children and the kids may be resistant,
Hmm.
one thing is that I would invite the entire family to come in, and the focus of therapy would be to discover what are the challenges in the family, and let each person share their perspective about what the family needs to do differently, or how what they're doing is impacting the family negatively and positively,
Hmm.
because then it takes the pressure off the person that you kind of identify that should be the client. So
Right.
that's one way. Another way, if you're thinking about adults, that I think that same philosophy could work. So if a spouse thinks another spouse needs to come in as a couple and
Mm.
say, our relationship is struggling, and I'm trying to figure this out. I don't know what to do, because then you're taking the focus off the individual person, and you're talking about the relationship. And that's what the other people, if you've got a siblings, 5 or 6 siblings and parents, and they're worried about one person, well, it's impacting them as well. And
Right.
so, but if you could come in as a family or a group or a couple or a parent and a child, whatever, and say, how can we make our relationship better? The
And
therapist is skilled enough to figure out, how do we pull out something from everybody, so then that one person is not singled out. They
okay.
may be more engaged then, because now they're saying, oh, everybody's got issues, right?
Right.
And
Right.
then they may say, you know what, I may want my own therapist, whatever. And so,
Right.
because they're starting to see. And I think that's one approach that has worked, with some clients that I had that were initially resisted on their own, but when they came in as a family or group, they were able to make progress.
Okay, that's good. That's good, because yeah, that's always, and I've heard people say that before. They're like, yeah, I want to go to therapy, or I want to do this, but I'm afraid, or I don't. I want this person to go, but I don't want. And they're not going to go by themselves, or this group is not going to go by themselves. There's an issue with families, and I see it. You see it all the time on TV, and you
Yes.
see Jan Van Zant, and the shows where she's bringing people on, and you got one person who's resisting. It's almost like it's an intervention in a way. But you start dealing with, you find out that it's not just a one person. It's a
Right.
collective group of the issues that everybody has, and it starts to come out, and then it becomes really a group session outside of just that individual person, the focus on that person. So that's good. That's good. That's good information on that. So I want to wrap up here. But I do want to ask a couple of things. Obviously, you provide a service, and you have a company, your own business. So what services do you provide?
Yes. So I'm actually really focusing more on the grief coaching right now.
Okay.
And so, as a grief coach, I really help people transition from loss and help them move forward to them accomplishing their goals. Now, what happens is that a lot of people don't realize that they have grief in their life. And so, a lot of times, people, when they've experienced a traumatic loss, especially, they become stuck.
Mm,
And so, and a lot of times, they're not able to accomplish goals, their relationships suffer, and even their own sense of self suffers. And so I kind of work with them to help them, attain that life or lifestyle that they're wanting, but has been, I guess, hindered because of the stuck points that they've had because of the losses that they've endured.
okay. And now, this, and I may know the answer to this, but I want to ask it because I think a lot of people always view grief as, a loss of a life. And is that focus more on the loss of life grief, or is it just grief of any loss? Loss of a
Grief of
job, loss of just general grief?
general grief. I mean, people are grieving now because of the pandemic as
Right.
well. So yes, so that's I work with any type of grief. I've also worked with couples because sometimes they're grieving their relationship because
Mm,
one of the either of them or both of them realize the relationship is not where they want it to be. So they're grieving what it used to be and kind of what it is
right.
now. And work with individual persons that were parents and kids relationships. They may be grieving that as well. So even though that may be the focus of the topic, but I do work with individuals. I work with family members. I do not work with minor children, so I only work with adults at this time.
Okay. But I mean, I think it's good to clarify that it's not just grief from a loss of a life. And I think a lot of people look at grief as that they associate, well, it's a grief counselor, when something happens in a school and a schoolmate dies and they bring in grief counselors, and everybody always associates it has to be, or it's always around death.
Yes.
And that's not the case. Like you said, it's loss. It's loss of something that happened in the past. It could be grieving, a lifestyle that you lived once and things change. I mean, it can be a lot of different things. So that's
False
good.
expectations, you
Mm,
thought at this age you would be here and you're not.
mm.
So
That can be a whole different, we can do a whole different conversation about just grief in itself, because I think a lot of people, again, even myself, until recently, I always view grief as just, the loss of life. But there are so many things that we probably grieve with every day that we have no idea that we're grieving. And once you start thinking of it that way, of any loss or any major change, or that the difference, you feel like you've taken a step back or you've gone down from where you were before. People are grieving that. I mean, it can be something as from your body. Like, my body, I used to be
yeah.
nice and trim and slim, and now I'm not so much. And people deal with grief in that, trying to get back to that place where they were, once before. So that's good. That's definitely good to hear about that. I guess last thing, how does somebody get in touch with you for your services?
Yes. So right now, typically the easiest way is to follow me on Facebook or Instagram. Just look for Dr. Tanya McKoy.
Okay.
Dr. Tanya McKoy. I also have a website, A New You Counseling, and that's ANEWYOUCC.com. And in that, on the website, a person can schedule consultations, and it also has my phone number there if they need to schedule consultations. But one of the ways too, of course, is the social media. I do provide some encouragement and some motivational things, as well as I post several different things related to grief, working through loss as well. But those are the methods and the manners that you can get in contact with me.
Okay. And I'll make sure that is going to be part of the notes for the podcast episode. So, listeners will be able to just go in there and click and get directly to you, because I know that you have a lot to offer, and, definitely passionate about what you do. And I think, dealing with grief in general, you have a strength that a lot of people just don't realize that's there. So, you definitely have a knack for that. And I appreciate, what you do, because, sometimes therapists get overlooked, especially in our community, for the importance of what they bring. Similar to a teacher, they get overlooked, and some people don't see the need for certain things, and why do you need that role? But we're starting to discover more and more, as through the pandemic and just other things, that it's necessary. It's very
Necessary.
necessary to help people to get through, just be able to cope with life, and not just cope with life, but get from, just surviving and just existing to actually living life. And again, for me, that's more of what the purpose of this podcast is for, is being able to live life to the fullest. And mental health is very much a key to that. So I appreciate you for your time, Dr. McCoy. Is there any last words you want to share before we sign off?
Oh, no, thank you so much for the opportunity. I enjoyed talking with you today. Hopefully, there was something said that your listeners can be encouraged by and get some understanding of. And also, your mental health is your health, right? Mental health is health. And so, when you think about your overall, if you ask yourself a question, how am I doing? Don't just think about physically, think about mentally and emotionally as well.
Mm, good nugget to end with. So there you have it, Dr. McKoy. We thank you so much, Dr. Tanya McKoy. We thank you so much for joining us on the podcast, and look forward to having you back on again someday to continue to talk through some of these things that a lot of people don't realize that therapists can help unlock. So we appreciate your time, and you have a blessed day.
Thank you. And you too.
Well, everybody, that wraps up another episode of the Airflow podcast. I want to thank our special guest, Dr. Tanya McKoy, for coming in and joining us, and sharing all the information that she shared. She really was dropping some jewels just about, mental health, and really sharing the some of the journey that she took. I always commend her about her strength, because as a parent, I can't imagine losing, a child, and losing her son. And also her son has a son, and having to really deal with that, and still come to her profession, her job as a counselor, and be able to balance that out. And as you heard her say, as a counselor, she needs counseling. She has a team around her, of professionals that help keep her grounded, help keep the weight off of her, so that she can do what she's gifted to do. And that says a lot, so it tells me that, she's definitely locked in to help, and help people and coach people through parts of their life where they may be stuck or there's darkness, and help bring light to those situations, and walk them through, and be, a guide, and a source of light for them through those times. So I just want to commend her. I want to thank her for the work that she continues to do. And I just want to make sure that everybody understands that if you are interested in services from Dr. Tanya McKoy and the New You Counseling Center, you can reach her at anewucc.com. That's ANEWYOUCC.com. You can sign up there. She has everything listed there in terms of how you can contact her, the different services that she offers. If you want to do an appointment request, if you have anything for consulting or speaking requests, she does those as well. And the cool thing about it, especially with technology, is she offers telecounseling, which means you can reach her and you can have your sessions virtually, through video conferencing. So, in those situations is really important, especially with COVID. And, some people are uneasy about meeting in person, and having those conversations, and just wanting to make sure that they're social distancing. And with that, that's fine. And I think that keeps you in a safe environment. You choose the environment that you're comfortable in, and she'll be in her comfortable environment, and you guys can talk and have those conversations, and really start to unload, and navigate whatever it is that's challenging you. You can also reach her on Facebook and Instagram at Dr. Tanya McKoy. That's the @ symbol DrTonyamckoy. That's at Dr. Tanya McKoy. And she shares information there. She also has, different events and things that she has going on if you want to follow her there. But I just, again, I want to encourage everybody to, take the opportunity, go, even if it's a few times, even if it's once or twice, just go and do some sessions. Find out, you'll find out there's always something that may be there. You've been dealing with it for so long, and it's not healthy to do that.
and it may be hindering you from achieving and living your best life. And so, as I mentioned at the beginning of the episode, the biggest thing that I wanted to do when I brought her on is just make sure that listeners understood that, again, my desire is for everybody to be, as an heir, to be healthy, wealthy, and wise. And that's always to be prosperous in everything. And your mental health is part of your prosperity. Thus, the title of this episode is Mental Wealth, because you can't talk about gaining and building wealth. You can't talk about prosperity. You can't have a spiritual growth and prosperity if you're blocked mentally. One of the places that the enemy attacks you is in your mind, and he will have you thinking things that are not true to keep you from being able to walk in faith. So some of that is wrapped up in past experiences. Some of that is wrapped up in things that were done to you that you didn't really realize affected you until you start to see certain things bubble up. And this is what a counselor can do, can help you with. There's no shame. You're not crazy. We have to stop this narrative, around the church community and the Black community that going to seek counseling is it makes you crazy. It means that there's something wrong with you. You've got a screw loose. That's not the case. You're going there to make sure that everything is good. And I think that's important to do. And that's important to say, especially in this day and age with the pandemic and just everything that's going on. People are looking at their lives differently. And a lot of people aren't living. They're just existing. They're surviving. They're getting by day. And as an heir, that's not what you were created to do. You were created to live life to the fullest. And that's where I want to make sure that information is shared just as much as making sure that your physical, your financial health, your spiritual health is where it needs to be. So again, as an heir, you were created to flow, and that is in everything. And I want you to flow mentally. So again, my name is Ricky Thomas, and I thank you for listening to this episode of the Airflow Podcast. We'll talk to you later.